Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by Spa Medica. Hello, Dr. Stephen Mulholland here in Toronto, Canada. Welcome to Plastic Surgery Talk and another one of our very popular podcasts. Hope you like this one. It is on non-surgical body sculpting. A lot of questions that come my way at meetings and in meeting with patients is, what can you do to kill my fat, unwanted fat, and areas of unwanted fat collection without surgery? The answer to that is non-surgical body sculpting, non-surgical liposuction, non-invasive fat destruction. These are all similar names for a whole new area of cosmetic plastic surgery that has grown up in the last 6 or 7 years, which is non-surgical lipo. We now have 5 well-documented ways that we can kill fat without surgery. So in general, at a center that's busy like Spa Medica, we're going to have several different ways that we can kill fat. And we're going to offer you the best combination of those ways to get a non-surgical liposuction result. It's grown up to be a very refined program. We're very good at killing 1, 2, 3 centimeters in locations where you just don't like the extra fat. And the risks are almost zero. The costs are very affordable. So non-surgical liposuction, one of the fastest growing areas in aesthetic medicine. So what are the different options to destroy your fat non-surgically? Here at Spa Medica, I've really invested a lot of time and energy and technology in always having the best ways to kill fat without surgery. It started almost 10 years ago with a technology that's still available today, that we still use in selected patients, and it's using ultrasound energy, focused beams of ultrasound. We've all had ultrasound before, diagnosing babies, diagnosing areas of our body. Ultrasound is gentle, it's not painful, and when we focus the 2 ultrasound beams, we can cause a cavitation or an oscillation of the fat cell and destroy it. So that technology is called UltraShape, one of the very first technologies. Generally, it's done 3 times, once every 2 weeks for a 6-week program. So UltraShape uses ultrasound to destroy fat. We can also use cold environments or hypothermia. We can suction couple the fat through a special applicator, and we can destroy fat with cooling it, or hypothermia, cooling the fat cell. And that technology is called cool sculpting. If we can suction, couple, and cool the fat to about 5 degrees for up to 60 minutes on the tummy, the love handle, thighs, we can destroy a certain amount of fat. Between 20 and 30% of the fat cells exposed will die from sustained cooling. So that's cool sculpting. Also a technology we've used at Spa Medica here for a number of years. We can also kill fat cells non-surgically with sustained heat, or hyperthermia, whereas cool sculpting is cooling the fat cell until we kill some. We can use sustained heating to kill the fat cell, and that is called sculpture. Sculpture uses focused energy on the skin. We cool the skin just like we would do during laser hair removal or a photofacial. We cool the skin so the skin doesn't get too warm, and we push the laser energy into the fat. So we're suction coupled cooling with cool sculpting. Sculpture is non-suction coupled sustained heating. We get those fat cells up around 45, 46 degrees, sustain that for 25 minutes, not 60 minutes like cool sculpting, and we can lead again to 20 to 30% of fat cells exposed, dying, a non-inflammatory, non-necrotic, means no redness, no swelling, no downtime, fat destruction. So ultrasound is UltraShape, cooling is cool sculpting, sculpture is heating. We can also use electrical energy, electroporation, to kill fat cells. And this is one of the more successful, again, technologies. It's going to be multiple treatments, usually 1 treatment a week for 6 weeks with something called Body FX, which is suction-coupled electricity that changes the cell membrane of the fat cell and destroys the fat cell. And after a series of 4 to 6 treatments, we can often kill 300 to 400 cc's of fat, like a small liposuction. So electricity is Body FX, also known in international markets as Tight FX. Ultrasound is UltraShape. Sustained cooling is cool sculpting. Sustained hyperthermia or heat is sculpture. There's other electrical systems that we can also deploy that can kill some fat, such as Vanquish. Vanquish is a non-touch technique. with large applicators that envelop your body but don't touch your body, and the RF or radio frequency flows through the fat. And generally you do a session that lasts about 45 minutes. We can treat the entire tummy and hips, so the largest spot size in the industry, or both the inner and outer thighs at the same time. A series of treatments, 4 treatments once a week to kill 2-3 centimeters of fat in a large area, and that's the Vanquish. So, just like you go with an anti-aging facial consultation, you're not quite sure what you might need to do. You might need a little Botox, a little soft tissue filler, maybe some laser and energy-based device treatment. Non-surgical liposuction has become very much like non-surgical anti-aging. You come in, we assess your body. Some patients are good for the sculpture plus some Vanquish, maybe some body effects. Others are good for the cool sculpting, maybe Vanquish, and some type of ultrasound or ultrashape. So we customize the treatment program for you. No matter what you do, it's going to be a series of treatments, between 2 and 6 treatments over 6 to 12 weeks to shrink significant amounts of fat non-surgically, painlessly, and generally very affordably. So it's a very exciting program, non-surgical lipo. We've got lots of options. We can customize a program for you to get you the best possible permanent fat destruction. These fat cells are dead. They do not come back. So who's a good candidate for this program? Well, someone who's realistic. If you want the best possible body contouring, you're generally going to see me, and it's going to be some version of modern liposuction, like Body Tight, Smart Lipo, Vaser Lipo, but it's going to involve a minor surgical procedure. That's the best. But if you want a good result with no invasive treatment, with no downtime, and more affordable, then our SpaMedica non-surgical lipo program is going to be a good one for you, because we can kill fat very predictably and in a focused way. So realistic, a good result, but it's not quite lipo. The patient has to be healthy. There can't be chronic medical diseases such as uncontrolled diabetes or active heart disease with angina. Certainly, we want to make sure that you're not pregnant at the time. You don't want to do any energy-based treatment when there could be a fetus in the uterus. And of course, no pacemaker in the heart, no pacemaker in the bladder, and no seizure disorders, because these are radio frequency electrical current devices that can stimulate arrhythmias. And so those are the contraindications, and the most important factor is just a realistic patient who wants a good result, but it's not quite as good as liposuction. If you fulfill those criteria, then you're a good candidate for a SpaMedica non-surgical lipo program. With the non-surgical lipo program, one of the common comments then is, okay, it sounds great, but how much fat can I really remove? And so let's say you have a pinchable amount of fat. And what are the most common areas? The pot or tummy, the love handles, the outer inner thighs, the arm or the bat wing, the bra line, and a double chin. These are the most common areas for non-surgical lipo. How much fat can you remove? Well, if you grab the fat that you don't like and imagine 2 centimeters of pinchable fat reduced, that's generally what we can do. Generally, about 20 to 30% of the fat in the affected area can be reduced. Now, with liposuction, I can make that 85 or 90%, but you have a minimally invasive surgery, you've got bruising, swelling, some downtime, and more risk. This is a risk-free, permanent fat reduction. These cells are gone. And so what happens if you have skin that's not very tight over top of the fat, or you're worried about skin that's okay, but would it be loose when the fat is gone? At SpaMedica, again, we have a combined program. So not only do we kill the fat, we put you in a series of treatments that involve tightening the skin. So the typical program looks like this. Cool sculpting and sculpture are done twice, 6 weeks apart. So you come in, you start with a sculpture or a cool sculpting. Then on week 2, 3, 4, and 5, you're coming in for electrical current treatments, the Vanquish and the Body Effects, or the X-Less, or the Venus Freeze. And we're tightening your skin with bulk heating RF while we're waiting for your second sculpture or cool sculpting, which happens after 6 weeks. So we tighten your skin, kill additional fat in the intervening weeks, and then we do the second treatment of sculpture, cool sculpting, the 6th week. So after 6 weeks, you've done all your treatments. You wait 6 weeks after the last treatment for all the fat cells to die and be washed away. And 12 weeks after you started, or 3 months, you're 2 to 3 centimeters reduced on the troublesome areas: tummy, love handle, bra line, arms, inner and outer thigh. What about planning your non-surgical lipo? When will you see a result? Now, if you come to see us here at SpaMedica and you've got a wedding in 2 weeks, you ain't going to be ready. You need to plan ahead. even if it's liposuction, which is a single session treatment, you need to wait a good 6 to 12 weeks till that lipo settles and you're looking pretty good. Same with the non-invasive lipo program. We do all our treatments over that first 6 weeks, and then you have to wait 6 weeks to settle. So you're starting to look good on the 12th week. So if you're planning a big event, a reunion, when you want to look awesome, and all those other chubby classmates of yours are wondering how you did it, give yourself 12 weeks in a Spamedica non-surgical lipo program. If your daughter's getting married, or if you have a big event, you got to go into the Caribbean, you want to look good in that bikini again, give yourself 12 weeks so that you have time for the fat cells to go away. A special topic that I think deserves its own question is, what about the dreaded double chin? The double chin here, very, very common in men and women. In fact, for men, it's one of the most common requested areas. The double chin is also treatable with non-surgical lipo. We've got a couple of options. We can inject a special chemical in the fat of the double chin called Kybella in the United States, or Belkyra here in Canada, and it works just like a chemical that's released from your gallbladder when you eat fatty foods. It dissolves and breaks down the fat. Now, it takes many weeks for that to do so. So generally, we offer energy-based treatments first for double chins: Cool Sculpting Submentum, or Sculpture Submentum, or Body Effects Mini. So we can cool the double chin and kill some fat. We can heat the double chin. Cooling is Cool Sculpting, heating is Sculpture. We can inject deoxycholate or Kybella in a double chin, or we can use electroporation called the Body Effects Mini. In general, we need 2 treatments 6 weeks apart with Cool Sculpting or Sculpture. So we do the treatment under the chin, takes about an hour. You come back on week 2, 3, and 4, and 5. We do bulk heating radiofrequency energy treatments with Body Effects Mini or Xless or Venus Freeze. Sometimes we'll inject a little Kybella out to the sides where we can't get at with the energy-based devices, and you do your second treatment after 6 weeks. And then you wait 6 weeks, and there's your final result. So just like the body, we can make a double chin much, much better contoured with non-surgical lipo programs, but it is a program. It's going to take multiple energy treatments, and you're going to get a pretty good result at 12 weeks. Now, what happens if you gain weight? You've done your non-surgical lipo program, you've done your multiple energy treatments, you're pretty happy with your 2-3 centimeter reduction, and it's the winter. You get depressed because it's always cold, or you have a breakup and you're feeling badly, or you have some emotional heating for whatever reason, and you put on 10, 15, 20 pounds, that fat's going to go somewhere, and it's going to go back to the fat cells that are left behind in the area you tried to contour, and they're going to swell up, and it's going to ruin your result. So even though these fat cells are permanently dead, you need to have a long-term and consistent approach to consistent weight maintenance. If you maintain that weight within 5 to 8 pounds of your non-surgical lipo program, you're going to have a long-term and permanent result. What is the cost of non-surgical lipo? In general, it's going to be several visits to the medical spa. You're going to have a number of technologies, and there's a substantial time commitment. The cost is quite affordable compared to liposuction. In general, whatever you pay for liposuction, the non-surgical lipo program is going to be about half that price. So in general, for a series of 2 Cool Sculpting treatments 6 weeks apart, 2 sculptures 6 weeks apart, you're looking at spending between $2,000 and $3,000 in most large Canadian markets, if you're going to do the tummy and both love handles. If we're going to have a combined program like here at Spamedica, where you get the Vanquish and you get some bulk heating radiofrequency treatments and we're tightening your skin, it's going to be between $3,000 and $4,000 on average. Now, if you look at liposuction costs for tummy and hips, it's usually around $8,000. So it's going to be half the price of a surgical liposuction treatment. It's going to be permanent destruction of fat. We're going to be able to tighten your skin and contour the fat quite noticeably and quite predictably. And in the case of my center here at Spamedica, because I do both Body Tight, Smart Lipo, and Vaser Liposuction, and I have all the non-surgical programs, we combine them. So if you're not happy or completely satisfied with your non-surgical lipo program, we give you a coupon that you can apply against services with me, the more liposuction type treatments, anytime over the next 5 years after your treatment. So customers, I think, really like that. They like the fact that they can coupon up against lipo if they want to. And we also give them a guarantee. If they don't get at least 1 centimeter of pinchable fat reduction, we're going to give them a free treatment. And about 8 to 10% of the time, because some patients are resistant to some energy-based treatments. We're going to offer you a complementary treatment of another energy that you didn't use already, because there's no point treating the fat cells that they prove to be resistant with ultrasound or cooling. We'll switch energies to ensure that you get the best possible results. So you're going to get at least a 1 centimeter pinchable result. We're giving you a free treatment, and it's going to be an affordable treatment that's about half the price of surgical liposuction. So how do you decide? How do you decide if I should do liposuction, body tight, smart lipo, vasor lipo with Dr. Mulholland, or see his medical spa and go non-surgical lipo? Well, first and foremost, if you're just adverse to doing surgery, you're a bit afraid, a bit nervous, you don't have the time or the recovery or the money to do the surgical program, you are automatically a candidate for the non-surgical lipo. If you have a short timeline and you want to get a quicker result, non-surgical lipo. If you are younger with good body contouring and skin tone and you think that lipo is a bit invasive for your age, non-surgical lipo. If you're a little older with loose skin, you may need to see me for better contraction with something like Body Tight. If you are the kind of patient that you don't care if it's non-surgical or surgical and you want to have the best result, you're going to do lipo with me. Now remember, lipo is done under local anesthesia. You do not need to do it under general. It's relatively quick, usually about 1 hour per zone, and you're going to get a much better result, but there is the recovery and some risks of surgery. And so how do you decide? Decide what your threshold for risk is and recovery. If you want a low risk, minimally invasive surgery with the best possible fat reduction, come and see me. Some modern version of lipo is probably best for you. If you are not going to do surgery, you're adverse to the concepts of surgery, and you want a noticeable improvement that's certainly visible and pleasing, then our non-surgical liposuction program with combinations of Cool Sculpting, Sculpture, Vanquish, Body Effects, Exless, and Venus Freeze is probably going to be best for you. What I suggest, come in, have a consultation, start out non-surgical, and see where your interests and opportunities lie. So thanks for joining us. Again, Dr. Stephen Mulholland here in Toronto, Canada, Plastic Surgery Talk, and our podcast series. Today, our podcast was on non-surgical lipo techniques, and we covered a broad range of interesting topics on how to kill fat without surgery. If you found this interesting, please share across all your social channels. We'd love you to share this information on social because we think it's pretty cool, and join us again for our next podcast.